So good afternoon. I think I'm going to get started. Thank you all for being here. I just want to say that it's really a delight to see so many faces in the room. There are also lots of folks who are joining online. Special thanks for participating via Zoom. I want to spend a second just introducing myself. I'm Vincent Guilamo-Ramos. I'm the Dean of the School of Nursing and also the Vice Chancellor for Nursing Affairs here at Duke University. I'd like to thank students, faculty, staff, alumni friends, all the administrators across the university and also in the health system. A very special recognition to our chancellor who's here in person. You came at the perfect time, Chancellor Washington, so welcome. And for those that are joining via Zoom, there'll be an opportunity for Q&A at the end of our session today, but also there's a feature in the Zoom that will allow you to post your questions. And actually, Luanda has graciously agreed to sort of monitor chat for us. So there are a couple of things I'm hoping to do this afternoon. And so I'm going to actually combine a number of things. First, I'd like to do the sort of historical, traditional State of the School address where we sort of celebrate and recognize all of our accomplishments from the preceding year. But I also want to spend some time thinking through and sort of presenting all the work that has gone on over the past 8 or 9 months regarding our new strategic plan. And so I'm really excited to be launching the implementation phase of the strategic plan. And then there'll be time at the end. I'm going to speak for about an hour, and there'll be some time at the end, about 15 or 20 minutes for questions, followed by a reception in the atrium. And so I'm going to start by kind of recognizing the things that we accomplished as a school over the past year. And feel free, if you so choose, to kind of applaud if you see folks that you know. Hopefully you'll know lots of people in the slides. And while many of you did submit slides, we in the Dean's office, we kind of changed them a bit. And so you may have some very positive ways in which we're depicting the accomplishments in the school. So there are 8 basic areas that we identified as being the focus of the presentation. And in the interest of time, we're going to focus on major accomplishments in each of these areas. It doesn't mean that it's the only thing that happened. It just means that we had to pick. And so we're just giving a highlight of some of the big things that happened across the school. So the little icons will appear on the slides, and you'll sort of know what it is that I'm referring to, and I'll make it a point to kind of reinforce that. So the first thing is in the education sort of program, an academic distinction. So you can see here at the School of Nursing is pretty consistently ranked in the top 5 schools of nursing across the country, but we're up from 3 from last year. We're currently number 2. And I think that that represents the hard work of the faculty and also the staff. And so congratulations, guys. Doosan is number 1 in the state of North Carolina and number 2 across the country. We have a retention rate of 95%, a job placement rate of 96%. And you can see that more than 90% of all of our students, our graduates, are exceeding certification and licensing pass rates across all of our programs. That's big stuff, guys. And I just want to take a moment to say thank you. Thank you. So another distinction in the academic part of our school. So Duke is the only nursing school healthcare organization in the entire United States to have all 4 NLN Centers for Excellence designations. You can see on the right-hand side, the top 3 pertain to our school, and the 4th pertains to the health system. And so we're the only school and health system in the country. Again, really, really big accomplishment. Thank you very much. For the 8th consecutive year in a row, actually the 2 people sitting right in the front are very much involved with that, Stephanie and Al, but Duke University School of Nursing is awarded the best schools of nursing for men in the country. And so again, congratulations for that. We have been very busy. Many people in our community have been working on a reaccreditation. And I know that there is a draft of that reaccreditation that has now sort of going through its editing and review as we prepare for our mock visit. But I think the important thing is that we reviewed in our self-study program outcomes, our available resources, the curricula, evaluation data, and ways that we're going to improve. And we're prepared for our site visit, which is coming in early sort of 2023. And so thank you, Val Sable, and all of the members of the academic program that have worked on the reaccreditation documents. Another important distinction, so the Duke University School of Nursing, the Center for Nursing Discovery, is one of 3 programs in the world with both the Society for Simulation and Healthcare and the International Nursing Association for Clinical Simulation and Learning it's a big word, INACSL accreditation. And only 1 out of 9 simulation programs globally have that particular sort of certification. And so again, recognition of the quality in terms of our academic programs. Last year, the school launched a Student Success Center. I know that's something that's been very important to many of the faculty and staff in the school. There were more than 200 students who engaged with the Student Success Center, specifically around areas that are not represented by Big Duke, but that really are sort of focused on our school. And so, for example, academic supports for the nursing program, career preparedness within nursing, and then skill-based workshops. There's also a mentoring component. You can see that here in terms of connecting students with alumni to establish meaningful relationships and support their professional development throughout the course of their time here and beyond. And so again, a major accomplishment for our school. A couple of exemplar student awards. Again, can't present all of them, but 2 that I do want to present. And so Johnson & Johnson student awards, both to Marcus Balik and Milenia Echagare Gomez for our race to health and equity, diversity. And these are our nursing scholars, terrific exemplars of our students in the program. Really big accomplishments in Sharon Doherty's shop and for the school more broadly. Doosan is ranked 5th in the nation in terms of nursing schools receiving NIH support, and we're up from number 9 in 2021. Big accomplishment for us and very important as a school. In terms of our research enterprise, I see a number of people from the research staff at the Center for Nursing Research that are here, as well as our Vice Dean for Research. You can see over time the number of sponsored project awards has increased, and you can see the total dollars in the millions in terms of extramural research has also increased. And so again, nice trajectory, and we're actually doubling down and looking for ways that we can do even more. So stay tuned. There's some slides later on in the presentation that will describe some of our efforts. We celebrated in DC at the Council for Advancement of Nursing Science, a really important honor. Our Vice Dean, Dr. Sharon Doherty, our Vice Dean for Research, was recognized as an outstanding nurse scientist and received that award at this national conference. Really big honor. I think a number of us were really delighted to be there with you, Sharon, so thank you. So the American Academy of Nursing has this signature program called Edge Runners. Edge Runners are nurse-led models of care that have gone through sort of external review by the committee that evaluates the Edge Runners. It's a very selective list of sort of programs that represent the best in nursing. But what's interesting about this program is that it really is reserved for programs that show that they've had an improvement in some sort of healthcare outcome. There's a cost element and also satisfaction. Our school has 2 this year. So Donna Biederman's work around germ homelessness care transitions, and then also my own work with Families Talking Together, which is for adolescents and sexual and reproductive health. Really amazing that our school is being recognized in a couple of weeks at the American Academy of Nursing. Congratulations, Donna. The Center for Nursing Research launched our first podcast. It was, I think hugely successful. 11 episodes were released. There's a QR code. They're all actually listed there, and you can see some of the topics that are being addressed, but they all deal with racial justice, inequity, and you can see on the far right some of the topics that were sort of the center of those particular episodes of the podcast. This is really cool stuff, and I think it's reached a lot of people, and we were delighted to be supported by Big Duke in preparing and financing this podcast. Congratulations, CNR. I think as a school, we've worked really hard at being able to evolve the kind of Doosan framework for social determinants of health. That work is being recognized nationally, and I think what was really delightful is that Dr. Shannon Zeck from the NINR, she asked us to present, and I had the honor of representing our school to provide a lecture on social determinants of health. It was not the same framework that historically has been presented. It really is our secret sauce, which we think at the School of Nursing is rather unique. And in that one sort of episode or lecture, or sort of workshop, there were more than 1,600 people across the country. Many schools of nursing have reached out to us asking for the framework, the slides, have been in contact with the school about what we're doing here at the Duke School of Nursing, and I'm really excited about this. This is something that we should be very proud of. I think that the country is seeing our school as being leaders in terms of effective mitigation of social determinants of health. So this is a way, the school has many different places that we work, and we sort of foster student exchange programs, visiting scholars, and also visiting professors. And so it goes kind of back and forth. And so here's a map. We took all the information from Ogachi and we placed it in what we think is a visually appealing way, but this is a long way of saying that we've got people coming, going, there's great reciprocity. We're working in very strategic places in the world, and we're really proud of our School of Nursing in terms of its impact across the planet. We know that a world without nurses is a world without health, and actually many of these areas that you see depicted on the map are places in the world where there's a significant nursing workforce shortage, and I'm happy that the school is engaging and working hard to advance health across our planet, so thank you. Some community health partnerships, really exciting. The MPAC Mobile Clinic, I think that this is something that is really innovative and distinct for our school. Congratulations to Donna Biederman and the entire team that is working on this particular project. But here is a 4-year cooperative agreement from HRSA that emphasizes rural and underserved communities, and that is heavily going to be focused on student training opportunities, particularly in the ABSN program, and that will focus on social determinants of health. You can see on the right that the school has been trying to bolster its clinical placement opportunities. And what's nice about this is that our focus in terms of these three that are being depicted here moves well beyond the traditional kind of brick and mortar settings in hospitals, but is looking at sort of placing students in settings outside of what would be the kind of customary place. And so I think really, really exciting, a school, the Department of Health, and then also an organization that, ACASA, that is involved in housing here in Durham. So again, congratulations to our community health efforts. Lots of important faculty service. I won't review all of these. I'll simply point out that there are many members of our community that are doing important things across many professional spaces, both within the school and outside. And here's just an example of some of the things. And you can see your colleagues here. Why don't we give them a round of applause? Thank you. Some of the work in the DEI space, I really, really like this slide because what's interesting about this, and I had not fully appreciated it until Dr. Carter and I were speaking recently. And what's really nice is that I knew that we were doing these programs, but I didn't fully appreciate how they were related. And I think the MAP program is really about students that are underrepresented who are thinking about entering a career in healthcare, nursing being one of those careers. But it's a great way to invite people to our campus early on, prior to their deciding whether or not they want to pursue nursing or some other health profession. And it's increasing access to sort of a wonderful career in health, but from groups that historically have not been sort of well represented. I think the other thing that's really exciting is the LEAP program, which is for advanced practice nursing preparedness and readiness. And it helps students who are currently completing their BSN or their registered nurses who are thinking about entering APRN roles and how to be better prepared to do that. And then this amazing program that focuses on underrepresented nurses and also students and staff, I should say. So students, staff, and professional staff in the health system working together around mentorship and really creating a space where they can be successful in terms of their career trajectory in the health system. So again, I think what I like about this, to be perfectly sort of candid, is that it focuses on different phases and it actually intersects with needs in different places. This pathway to nursing and this idea that we're not just producing nurses who will sort of work at the bedside, but across the entire sort of trajectory of their careers, that we're working to sort of build that pathway. So I think this is pretty cool stuff. In the DEI space, more accolades. I think we've created some awards internal in the school to recognize students, faculty, staff. We've also, there's been some scholarship that actually Bridget has led that has been published in the Journal of Professional Nursing. You can see that here on the slide. Dr. Small here has also been acknowledged for some of his work on DEI and simulation. And Drs. Carter and Webb, Dr. Webb has been really instrumental in helping with cultural intelligence and how to better prepare our community internally on sort of challenging dialogues, thinking through how we deliver our academic programs, what does it mean in terms of research, and how we relate to one another. And I think these CQ perspectives are really important for us as a school and as a community. Many, many, many faculty promotions. I'm not going to read all of these, but I'll leave those on the slide for a second. And you can see, I think there are about 10 people, if I'm counting correctly, that are depicted on this slide. And again, many people moving from wherever they were to the next logical step. It really speaks to the tremendous scholarship, research, teaching, service, clinical practice that is happening here at Doosan. And I think it's a great testament to all the hard work that is happening. So congratulations to everyone on this slide. This is really wonderful to see. Some staff promotions also in the school. I think you can see here a number of individuals. I do want to call out maybe just 2 people. I'd like to identify Val Sable. If you could stand for a second, and Sharon Doherty, our Vice Deans for Academic Programs and for Research. Thank you very much. You guys are stepping in at a time when the school needs you, and I think you've been doing a phenomenal job. And so thank you very much for your service. Lawanda, it would be remiss of me not to acknowledge you've stepped in as well as leading our communications efforts. And I really have appreciated that Lawanda has been reimagining strategic communications versus simply communications. So thank you very much, Lawanda. So BB, you're in the back, so you're not gonna get away with not being recognized. Stand up so we can actually celebrate you. You have been promoted to Associate Registrar, and so thank you. Thank you very much. So I won't review the others, but I think everyone should, if you see these colleagues in the school, send them an email, thank them, celebrate their accomplishments, and thank you very much for the hard work. This is a testament of everything that's going on, again, in the school. Some faculty fellowships, really big stuff. I think Dr. Carey and Dr. Randolph, I don't see either of them in the room, but we're about to have a really big celebration in DC. We're having a soiree, we've got tables, we got a reception, we got champagne. We have a lot of good things that are happening in DC. Both of them have been inducted into the American Academy of Nursing. And I think this is the highest honor in our profession. And I can't think of 2 more deserving colleagues among us. And so please let Michael and Shanita know how much we support and admire and honor them. And come to the reception on Thursday evening. It's going to be terrific. It's not only Michael and Shanita, we've got Dr. Chris Simmons and Dr. Elaine Couchinger, who have also been inducted in their respective professional fellowships. And so again, lots of accolades and lots of recognition for the tremendous work that's happening here at the school. I can't go into all of the awards and all of the accomplishments, but here's a summary. Folks sent a bunch in, and what we tried to do is summarize them in aggregate form. So 33 faculty received some sort of scholarship, teaching award, leadership, service recognition. 11 students received awards, and 8 staff received awards. And so again, maybe just a round of applause for everyone in our school. Thank you. Our cluster hiring initiative, boy, this is interesting. So we launched a 3-year cluster hiring initiative specializing with a focus on social determinants of health. So that announcement went out. We got 28 candidates. Crystal, who's sitting in the back, we had to shut down the actual portal because we were getting so many CVs from folks. And I think of those 28, the committee worked very hard. We identified 6 candidates. And I think we're still in the process. We have several visiting us in the next couple of weeks, but I am happy to announce that one of the individuals has accepted our offer. One has an offer that's outstanding that we're waiting to finalize. But I think we're well positioned to bolster our faculty with more expertise in SDOH. We're going to continue with this particular theme over the next 2 years, so this year and next year, and we're hoping to bring many new faces to the school who will somehow fit into our academic mission in one of the programs, our research enterprise, clinical practice, but what threads them all together is their commitment to social determinants of health. Meet Dr. Derek Glimpf again. You know Derek from his visit here. Derek's an impressive man. He is a fellow of the American Academy of Nursing, which is where I first met him when he was being inducted last year. He's also a fellow of the American Association of Nurse Anesthesiology. He's a national expert on pain management and safe opioid prescribing strategies. He is a DNP and a PhD. He's sort of a double doctorate. He's also received many awards for his service in the military and still is active. And he has agreed to come to our school starting in January as a faculty member. He will oversee the clinical placements and coordinate all of them in the CRNA program. So please send an email to Derek and let him know that we're really excited about his coming. I heard that he was looking for a house this weekend and that he was in North Carolina house shopping. So hopefully he found one. So we did a big project that was focused on sort of our transition year coming out of COVID and sort of thinking about how we can move forward as a school. And there is a pretty extensive process that faculty and also staff and students were involved in. It's called the TYT, the Transition Year Team. And I think, I'm trying to summarize here many different aspects of the school. And I think the work that was presented, I'm looking at you, Al, because we just met about this. There's a lot of data, which we will be presenting at another time. But what I wanted to share that I think is important, what you see going across the slide on the bottom is all the different divisions and the major units in our school. What you see sort of going in the vertical axis is sort of to what extent people agree or disagree. And you can see across on a scale of 1 to 4 that green line that cuts across is 3, which basically means people agree. And across every single unit in our school, people felt that despite our hybrid work model with some face-to-face, but also some remote work, that each of those units was accessible and also responsive. And that's something that I think means a lot to our students, to our faculty, our staff, and our alumni. And so thank you very much. This is a huge accomplishment. I think it's very important for us. Thank you. So some financial positives. I'm thinking of Vice Dean Bowersox, who's sitting in the 4th or 5th row. And so we made significant commitments early on to investing in faculty and staff and also students. We used our resources. We invested more than $1 million in investing in ourselves and our future. That's something that was very important at the start of my joining Doosan, that we really need to respond to the moment that we were in, because folks were asking us to provide some immediate relief and support. I think we have spent more also in this past year in terms of our outreach efforts and our marketing, particularly as it relates to our ability to attract students to the school. But despite the additional investments, and those investments were very important, so there was something that we had to do, I think it's noteworthy that we still had a small surplus. I think that's something that shows the stewardship of our school's budget and David's masterful management of our resources. So thank you very, very much. I think this is terrific. Turnover rates. So this is an interesting slide. And so what you see here is sort of national data on turnover. We know over the past year, there was a lot of language about the Great Resignation. More recently, it's been sort of the quiet quitting. But I think what's depicted here is something that we should be very proud of. You can see in 2018 through 2022, although the 22 data from the Bureau of Labor Statistics is not quite yet ready, but you can see the national percent in terms of turnover rates. You can also see at Big Duke, which is the purple color, and you can see at Doosan. And I think this is a very important slide because it speaks to our school. And despite our challenges, and we certainly have challenges, I think that people are still very committed, and I'm very thankful for that. So thank you very much for being involved in the school. Thank you. Communications and marketing. I think that what you can see here is, historically, our communications and marketing has been primarily focused on a couple of key areas. One, really communicating internally in the school and really speaking to our students, our faculty, and our staff. And also, to some extent, which is what the dotted line represents, to colleagues in the nursing profession, and then also to some extent the broader university. I think what's been really masterful is that Lawanda has been helping us to rethink how we do this. And we certainly want to do the things that are on the left. And we want to continue to communicate to our sort of internal community. We want to engage the university even more in terms of our messaging about what makes our school special. And we also want to ensure that we're communicating with our nursing colleagues. But we also want some expansion in terms of our reach and some groups that historically have not been part of our messaging. So one is policy and key decision makers. Nurses have strong views and we have expertise about things that are happening in healthcare. We want key decision makers and policymakers in particular to know that. And I think we've been trying really hard to engage them and to have our kind of nursing solutions to some of the challenges that we're facing as a country resonate and to sort of at least be on their radar as being a possibility in terms of something that they should consider. We've been much more active in local and national media. This is something that's very important. Much of what's depicted about nursing tends to be pessimistic and it tends to describe what happened over the COVID-19 sort of height of that epidemic. And I think you guys know from the famous Woodhull study that nurses are almost never depicted in the media, that whenever we are, it's only about nursing topics. We have opinions about healthcare delivery. We have opinions about public health, and we have opinions about policy, health-related policy. So we're trying to be much more assertive about local national media and getting positive stories about the impact of nurses and how our voices can retell the story of why it's a great profession and a great career. And then also we want to engage community and advocacy partners, but with a particular emphasis on people who are unaffiliated with our school. I think for a long time we've kept close the people who are supporters, and we want to keep those guys close, but we also want to invite other members into our school, especially ones that don't know a lot about us and that are sort of curious about who we are, the value of nursing, the importance of nursing. We want to target those perspectives as well. Here's a couple of examples, a year of impact at Doosan. Again, just some examples. We were fortunate to have Director Harold Phillips. You guys know that Harold works in the White House. He's sort of the top federal national leader in the HIV/AIDS response in our country. And he participated in an important session here at Doosan on the role of nurses in ending the HIV epidemic, a call to action. I'm happy to report that I am going to be speaking, I believe it's on October 25th, that's via Zoom with a closed session at the White House about the role of nurses and expanded scope of practice in resolving the HIV/AIDS epidemic. Really excited about that. And again, our message is resonating. People are listening. Secretary Kingsley was here and he also spoke about responding to and recovering from a global pandemic. I think what was nice about Secretary Kingsley's comments is that he reflected on the important role of nurses. And since that time, he's agreed to come back. He's been involved in some video projects. And as you guys know or are going to hear now, he's our December graduation speaker. And we'll be speaking about the important role of nurses in our state in North Carolina, which is terrific. Dr. Sylvia Trent-Adams, the former U.S. Surgeon General, she actually also visited us in person. What a tremendous delight to have Sylvia here with us. The new normal, preparedness, and she talked a lot about the important role of nurses in leadership and thinking about how to push some of those boundaries and to think about sort of interprofessional practice. And again, just some examples of the kinds of people that have been visiting our school. We were supported by Duke Health and in particular the chancellor and some of the other leaders to take a stance and to testify in Raleigh around expansion of scope of practice in North Carolina. That was a terrific opportunity to really make a case, to review the evidence and to talk about why people of North Carolina need access to care, and nurses are certainly a big part of that. What a great session we had. I believe it was last week. Time is escaping me a little bit, but Lauren Hilgers from the New York Times, I thought that was phenomenal. I listened to the recording after she left, and I think her message about the value and importance of the nursing workforce and just her willingness to continue to engage us, to actually be involved with our faculty in terms of elevating the nursing perspective, whether it be through op-eds or other kinds of stories that she can write that tell the positive aspects of nursing. This is really important for our school. And so again, a year of impact at Doosan. We are meeting this week. We've got in our Dean's Lecture Series, we've had some focused talks over the last year, and they will continue this year and beyond across the areas that you see in that figure that's represented on the left. Whether it be social determinants of health, the workforce, issues around payment, around education. And for Hispanic Heritage Month, which we're in right now, Dr. Margarita Alegria is going to be speaking. She's a Harvard professor. She's probably the country's leading expert on Latino mental health. She's absolutely phenomenal, an icon, and happy that she'll be here in person on Wednesday. And look forward to really having Dr. Alegria with us. If you haven't registered, you've got a virtual option, an in-person option, and there's still time to sign up for her workshop. Thank you. Some examples of some of the outcomes that we've had as a school. We've doubled Doosan and nursing's mention in the media from last year, and this is very important. I've asked Lawanda and that team that you work with, Lawanda in Communications, to really keep track of, what are our stories, where are we showing up, how can we increase that number? A lot more stories about nursing, particularly positive stories about things that we as a profession are doing to have a positive impact. And so again, major accomplishment for our school. With Anita's shop with Alumni Affairs and Development, I think Anita sort of got me really busy last year in a very ambitious national sort of engagement and really wanted me to have a series of one-on-ones, small intimate fireside chats, and then also some large-scale Zooms. Over 1,000 alumni and donor participants, and this is really cool. The development team mapped all of those individuals to different places in the country where they come from. And I think I had no idea that we were reaching as many people as what you see on this slide. Doosan is really engaging alumni and donors across the entire United States. And so I'm really excited and thankful, Anita, for all the work that your team is doing. Thank you. Our fundraising accomplishments, you can see our sort of goals in the past, 2019 to 2021. You can see that we had a goal of 3 million and we surpassed that. Our actual, for the past year, for 2022, was also a goal of 3 million, and we were at 5.6 million in new commitments. And so again, it's showing the tremendous work, and it's showing, Anita, the payoff in terms of our messaging and our engagement and how we're getting people excited about our school. And so thank you very much for that. Some specifics about those monies, you can see where they're sort of being committed to. A lot of it is financial aid for students and scholarships, and that's a great thing. We want to make the possibility of being able to attend Doosan reachable for people who otherwise would not be able to join us. There are some specific sort of programs or scholarships that are reflected in the inner circle. You can see for underrepresented students, you can see for veterans and active military, and you can see for entry level or pathways into nursing programs. And so again, I think this is really terrific stuff. So I'm gonna stop and maybe we can just pause for a second, and I'm gonna transition and talk about the strategic plan. But if I forgot anything, I'm sorry, but those are the things that stand out as being major accomplishments. And before I talk about a little bit about our future, I just want to say thank you to everybody, because I see all the hard work depicted in these accomplishments. I think there's a lot more that we could say that is not reflected here. And so thank you very much. Thank you. So our strategic plan, and so I'm going to review some of the things that folks know, but then maybe put some things sort of out to our audience that may not have heard of some of these things before, in a way that gets you excited about where we're going and some of our collective work and future together. So I think mostly everyone knows that we worked with an outside consulting group, Slalom. Slalom was selected because they were incredibly innovative and pushed us out of the box thinking. I think one of the things that I liked about Slalom was that they really articulated what they called a data-driven approach that would help us to build on our legacy of excellence. And so I think there was wide recognition that Doosan is a phenomenal school and that we're actually building on a platform that is solid. But what we're interested in is how do we prepare for the nursing workforce of the future, and how do we best align with what's happening in healthcare and help our school to be part of the solution to some of the challenges that are going on, more broadly. On Friday, we had our board of visitors here in the building, And we were fortunate that Executive Vice President Daniel Innes was with us, and he had an opportunity to speak to the Board of Visitors. And his presentation was phenomenal, and he talked about some of the university priorities and then also places where Doosan fits in. But one of the things he said was picked up by one of our Board of Visitors, and that then resulted in a kind of, I don't know, sort of like popcorn in the microwave. Things started percolating and popping, and people started to comment. So I'll tell you what they commented on. He said that the School of Nursing had been a very exemplary place, that it's been a terrific school in terms of resources and budget and how we've managed, and that in many ways we're outliers in the right direction, that we've done really well. And one of the Board of Visitors said, and it was a pivotal moment in the meeting, she said, "That's wonderful to hear, but how about having the School of Nursing play a larger role then in helping other entities, particularly our health enterprise, with some of the solutions in ways that we can support what's happening elsewhere?" And I think that led to a lot of interesting conversation, and it was a real recognition of all of the great things that are happening in the school that we need to elevate up. I was happy that Daniel heard that, because I think he really heard it. And I think he was excited by some of the things that people were talking about. And I think we are onto something big at Doosan. And I think our collective task is to try to ensure that we can convey that in ways that are supportive of what is happening in the broader context. So we started in February of 2022 with our kickoff. You can see our 5 phases. Where we are now in this 5th phase is really launching our implementation. We spent a lot of time engaging many stakeholders, both people who are the traditional partners, folks within the school, our faculty, our staff, our students. But I think what was interesting about Slalom's approach is that they were very interested in speaking with folks outside of nursing, folks who hadn't really thought about nursing or weren't sure about nursing, and getting their perspectives on our school and the nursing profession more broadly. We went through a lot of analysis of data and artifacts, major reports, different data points in our school, from our admissions, our recruitment, our financials, our marketing strategy, our communication strategy, et cetera. And we also went through what I thought was really exciting, the Art of the Possible workshops, which is in that phase 3, where we defined our future. Forget about resources, forget about what we've done, forget about what's practical. Let's imagine 30 years into the future. What would we want in our school? Where will we be? And if we were to walk back in increments of 5, what would that mean in terms of what we should be doing? I think those workshops were pretty, instructive, and I think lots of ideas came from them. And I think in one of the following slides, you'll see there were 90 different ideas that came out. And those ideas were bold, and they were big, and they were very different. It doesn't mean that we only were sort of pie in the sky. We also looked at our current state, what are our strengths, and then also gaps, and we balanced all of that. I think that was pretty important. We've been socializing and prioritizing, lots of discussion in the school. Since Slalom ended their engagement with us, we've gone forward, and we've continued to have a lot of dialogue, particularly about our mission and about sort of redefining who we are as an institution. I'm happy that today we're actually going to be launching the implementation phase, and we're going to start moving towards how do we pick some initiatives that we can work on in this first year. And I think there are a couple that are sort of important based on what we need to do as a school. I think there's been strong counsel from some of the leaders in the school that we should look at what we have before us, things like our reaccreditation, our curriculum review, and think about ways that we can put some of our initiatives and our new work into existing processes that we already have going in the school. In terms of stakeholder engagement, I mentioned the 4 Art of the Possible workshops, 90 big ideas, 91 participants. Almost everybody had a big idea. I don't know if that is exactly how it went, but it's roughly like that. 60 interviews, focus groups. There was a survey that asked people to weigh in. There was also mission statement workshops. There was research around what was happening in the broader nursing profession, articles, reports, big trends. And then there was an analysis of our peer institutions, not trying to replicate what they're doing. We want to be very mindful, but just to kind of take a peek and see what are those other top schools of nursing doing, and how can we identify what is distinctive about Doosan, and how can we identify some potential gaps that our school is well positioned to address. And then we came up with our strategic plan, and I'm going to share some of that today. I also want to acknowledge that we looked very carefully at the previous strategic plan, right? And so what were the things that were in that plan? what were the things that were successes that were accomplished, and what are the things that, despite our efforts, we still need to work on. And so all of that is in our plan. We've got a structure that's depicted here on this slide. We have some focus areas. No surprise, they're pretty traditional focus areas with the exception of one, which I'll point out sort of a little bit later. We've got some priorities that are some of the areas that we want to execute on over the next 5 years. The very specific initiatives that we're currently working on, the metrics within the implementation teams that are being formed on the initiatives that we're going to be pursuing in this first year. We've got about 22 or 23 initiatives. We won't be able to do all of those in the first year, but we will take some of them and we'll work on those in this first year. And then we've got, sort of a lot of work around developing a dashboard with quantitative metrics that can really be public. It can show us as a community exactly what it is that we're doing and how we're making progress towards that. And that's what we're working on now. That's what's being developed. I think that our North Star, our mission, this was very important. We've spent a lot of time over the last couple of months really thinking through what Slalom had put forward based on the 8 months of their work with us, but also our own internal discussions about our mission. And so I want to share this image, which many of you have seen, but for those of you that have not seen it, I just want to talk about this because I think it was something that was a turning point for me. And I think for many of you in the school, I think you related to what's being depicted on this slide. So on the far left, you can see that there are two children, male or female, doesn't matter. They're both trying to access the apples. And the child that is on the right-hand side is sort of questioning how he or she is going to reach those apples. The tree is sort of tilted to the left, and the apples tend to grow more on the left. And that child is not able to directly reach the apples, but occasionally apples fall on his or her side, and he or she is able to benefit from those apples falling there. And so that is, in many ways, a real visualization of what we mean by inequality, and that this is sort of systematically not allowing for the child on the right to be able to access the apples. You can see on the far right that we've got equality, and here what we're doing is we're doing one size fits all. And we have a couple of places in our school where we probably want to look at this. I think we probably treat everyone the same. Maybe we give the same amount of financial aid to all students, just as an example. Could be wrong about that, Dave, but I'm just using that as an opportunistic example. And so in this case, both ladders are the same size. And you can see our two children again are trying to reach for the apples. And yet on the right-hand side, he's closer, she's closer, but they can't get the apples. They're still too far. On the left-hand side, that child is able to fill his or her bag and is filling the bag with apples. And you can see that the tree is still slanted to the left. More apples are growing on the left. And so again, sometimes equality, treating everyone the same, doesn't necessarily resolve the issue. And in some ways, it could actually exacerbate it, make it worse, because more apples are going on the left because both have been elevated. But I think because it's the same, it's not a customized approach. What you see in the lower left-hand side is really equity. And equity speaks to these customized approaches where we know we have the two children and they need different size ladders in order to reach those apples. And so you can see here that the child that is on the left, he or she is able to fill their bag with apples. And that's a great thing. That's a wonderful thing that that child can do that. But what's also really impressive is that the child on the right is able to also presumably fill his or her bag with apples because their ladder is taller and it allows them to reach the apple and to have access to and benefit from those opportunities, whether it be in education at Doosan or whether it be accessing quality healthcare. I think what's interesting is that our tree is still slanted to the left. And because that tree is slanted to the left, then more apples are growing on the left-hand side. And so even though both children can access the apples, just as a function of how that system is slanted, you're going to have more apples on the left. And so that child's going to fill up their bushel. And over time, we won't really see that because what we're looking at is the equity approach, that it's customized to both children in those ladders. What we need to do is think about somehow straightening that tree, that those systems, those institutions, the way that we deliver healthcare, the role that nurses play in the delivery of healthcare and ensuring access, quality, and reducing costs, that we are pulling that tree straight And that when we do that, we see that the apples grow on both sides. Both children are able to access the apples. And it's not just for one group or another, it's for all of the children, it's for everyone. And what's really powerful about this is that it speaks to the fixing of the system and these ideas of justice and really being able to ensure that both have access, they have the tools and also the opportunities to thrive. And I think this is really important for us. And as a nursing profession, when we look back at the history of where justice fits into our profession, it's well documented. It's there, it's been there for a very long time. I think over time, it may be that for some of us that may have eroded that awareness that it's not just about the apples and being able to access them, it's about also straightening the system that produces the apples. I'm happy to report today and share that we have worked collectively as a school at developing a new mission statement. And so I want to just pause for a second because there was overwhelming endorsement from the school about this. And this was not easy for us. This was a lot of discussions that were emotional, that were very much rooted in things that we believe and that we want for ourselves, our families, our own personal and professional experiences. And there was also fear. And there was concern about, is this potentially going to exclude people? And I think what's wonderful is, again, this idea that the straightening of the system is about all children, all people being able to access those apples. And so we at the Duke University School of Nursing, we advance health equity and social justice by preparing nurse leaders and innovators with a commitment to improving health outcomes through transformative excellence in education, clinical practice, and nursing science. So this weekend, actually on Friday, the Board of Visitors also had some feedback on the mission statement. And I think one of the concrete suggestions, I pondered it over the weekend, was they wanted us to move transformative to the beginning, so that our education, our clinical practice, and our nursing science are all transformative. In the initial version, it was just transformative nursing science. And so I'm really happy that we're placing emphasis on all three pillars of our enterprise here at the school. And so thank you very, very much. So taking a step back and sort of thinking about what's happening, and again, we'll not be able to do justice to this kind of idea, but I do want to share that we know a couple of things have been in our minds and in our hearts. You know, we know that life expectancy after, sort of 4 decades of increasing has been stagnating. And recently, in the last couple of years, it's actually been dropping. There was a pretty alarming story in the New York Times about the historic low of life expectancy in our country. We are experiencing higher rates of mortality, and we're also experiencing sort of greater, sort of comorbid or actually morbidity from chronic disease. And so you can see here that at this point right now, where we are, that about, I don't know, out of 40 or 50% of our country currently has, if you're an adult, a chronic disease. That number is projected to increase by 2030. And again, what this is speaking to is that our life expectancy is getting shorter and more people are living with chronic diseases. And while nursing has always been focused on prevention and sort of whole person contextualized care, wellness, I think it's time that we do more, and that it's no longer the case that we can solely train our healthcare workforce to sort of intervene when people have these conditions. We need to disrupt the trajectories of sort of illness and that progression of disease. And I think there are great exemplars of nursing science that will help us to do that, that's here in the school. 1 in 10 Americans are uninsured, 1 in 5 Americans are underinsured, 2 in 5 American children are covered by public option, such as Medicaid. And so you can see here that what that means is delayed care or not getting care. Not acceptable in terms of people being able to access care. We've had many large-scale events. This is one of my favorite slides. You guys have seen it, but I really believe that this is an important one for us. The context of healthcare delivery, prevention, health promotion is increasingly being shaped by these factors. We focus a lot on the COVID pandemic, but it's not just that. It's also what's happening with mental health and substance use in our country. It's growing inequality and, sort of people who have inadequate, financial means to cover their basic needs. It's what's happening on the US-Mexico border, which is not just Latin America. It's not just Mexico and Central America. Across the planet, people are trying to find a home in a country like ours, and they're entering from our southern border because they're in search of a new place where they can live safely and have more economic opportunity. It's Black Lives Matter and recognition of structural racism in our country, and that is an important role. The social is the physical, it's biological. It's not just people's perception. We know that these things shape, and they're very pronounced. There are physiological changes that folks experience when they experience these adverse events. There are many things that are happening. Climate change, I would be remiss not to mention that. Look what happened in Florida and Hurricane Ian. And, I said to the vice deans, boy, I would love to be at a place at some point in the future where our school, the Duke University School of Nursing, that we could show up and we could go to Fort Worth and we could actually, or Fort Myers, and we could actually respond and help people on the ground, boots on the ground. That's what we want for nursing. And that's exactly what we want to be in terms of leading our country in terms of responding to our health needs. So really important stuff. Despite all that we do in the clinical space, I think it's well established that 80% of what the variation is in terms of outcomes is tied to social determinants. The context in which people live really matters, and we need to be able to do a better job at responding to that. We know, and in February, we'll have a visit from Jay Bott and colleagues from Deloitte. They'll be here to present this paper, that they modeled the cost of inequities in our country. And what they talked about in terms of the financial cost is that right now, today, the cost of inequities is about $320 billion. This is the financial burden that we as a country face for not the delivery of healthcare, but the preventable pieces that if we averted that, we would save that money. If we did something different, if we had a paradigm shift. By 2040, our colleagues at Deloitte estimate that it's going to be $1 trillion. It's not sustainable. We don't have a way of moving forward as a country if this is what we're doing. This is preventable. We can do something about this. And nurses have to be a big part of that. It's not just financial costs. It's excess morbidity, it's premature mortality, it's unfulfilled human potential, it's reliance on health and sort of social welfare programs because of illness or chronic disease. It's also eroded social cohesion. We know that when folks are challenged by some of those large-scale events, that it's more likely that we feel alienated from one another. We start seeing violence in communities. We start seeing escalations of tensions because we don't feel like we're being supported in terms of the ecology of our lives. Excessive bereavement, and then also caregiver burden. Many of our faculty actually study and research caregivers. And so more and more request and demand on caregivers to play roles that our health system broadly, not just the brick and mortar structure, but all of us, that we cannot do because we've got more chronic disease. We got to do something different. We need a paradigm shift. Nursing is part of that. We've got to speak up and actually show that we've got a nurse-led model of care that actually can do something about this. And so I'm really excited that we're going to be focusing on a lot of this in our strategic plan across the major areas of our school. And so really quickly, I know that we're about 10 more minutes before we wrap up, and I've got a couple more slides that I want to share, but some areas that you guys know in terms of our strategic plan. We would like to develop this idea of the nurse-led model in terms of prevention, health promotion, and treatment. We see this as an opportunity to improve outcomes, access, and reduce costs. We want to be the national leader, not just a school that is developing and implementing and testing these models, but we want to be seen as the school of nursing that really is the best at developing these models, and that we can also do this in an interprofessional way. It's not just about nursing. So I'm looking at colleagues in the room that are not nurses, but there's a role for all of us. These nurse-led models of care will be better informed by interprofessional collaboration. We know that in our practice area that we're going to develop more partnerships. We're going to try to scale up some of our community work in a way that we can demonstrate the power of nursing. And we're also going to we've got about 11 or 12 I was working with Vice Dean Doherty and identifying about 11 or 12 current nurse-led models in this school. I hadn't realized that we had so many. We got to figure out how to package those and start thinking about how do we move them across the care continuum and across different settings so that we can show the power of what we're doing as a school. We've got this terrific initiative that I mentioned already. I won't repeat it, but this is exciting for us, the MPACT Mobile Clinic. It's just one example of moving the locus of care to the community and bringing care to real people. And I think that the school should be very proud of this. We know that NINR agrees with us, or we agree with NINR, that really we have an opportunity to address and solve the most pressing, challenging health problems. We think that it is our role as nurses to optimize health and to advance health equity. Look at the research lenses below. This is the focus of what NINR plans to fund. This was pretty definitive at the most recent Council for the Advancement of Nursing Science, where Director Zhang said, these are the things that we're interested in supporting: health equity, social determinants of health, population and community health, prevention and health promotion, and systems and models of care. Dusan is right there. We're speaking that same language. We are well positioned, hint, hint, to actually get some infrastructure support from NINR to develop expertise in our school. And so we're really excited about that. Dr. Doherty, Sharon, has been helping us to develop a cohesive vision for our research. We've been more so independent investigators. It's time to come together and to think collectively, how can we amplify and how can we elevate our collective mission? We want to expand the breadth and depth of our research portfolio and do even better than what we've done historically. And the way to do that is to come together and to amplify the effect, working as a team. We know that we need some more theoretical, statistical, methodological expertise. One of our initiatives is to build on our strong foundation, but to have more emphasis on science and to bring rigorous nursing science to our school. Center training grants like a T32, rumor has it from the doctoral program retreat that there is some discussion about a T32. Thank you very much, Sadosa, for that. And that we can have collaborative grants that will help us to support our school in terms of moving our research programs together. We've got to translate our work into policy. It's not just about publishing that work in, sort of a rigorous peer-reviewed journal. Certainly we want that. We want to create knowledge. But what we really care about as an applied profession is transforming lives and having policy and the application of what we're doing. Much more emphasis in our school around that. I've mentioned the cluster hire. We're going to keep doing that for the next couple of years. Thank you, Crystal, for all your work on this. I know that's created a lot of work because many people are interested. We are nationally being recognized. We pivoted with our communications team to starting to own this message around nurse-led models of care. But we were the keynote at the Council for Advancement of Nursing Science. A number of you were there. There's national enthusiasm about what we're doing at Duke. People are seeing our SDOH model and the way that we're approaching mitigation of the harmful effects of SDOH in ways that are really exciting. And I think we should be proud of that, and we should amplify the voice and keep on pushing on that. We know that there are challenges in nursing, and certainly today is not about sort of the bad news, but we want to be mindful that we do have some challenges. This great paper in Health Affairs, Dr. Peter Beerhouse, who documented 100,000 fewer applications, particularly from early, younger nurses into bachelors of nursing programs. We got to keep an eye on this. When messages are negative and pessimistic about a career in nursing, we see dips in the applicant pool. We've got to think smart and we've got to think strategic about why do we draw people in to this fantastic career that's called nursing. We need to enhance our pathways, develop more competency-based education, moving away from hours and much more focus on competencies. We want to do some innovative things with our technology. We're already doing some of that. We want to do even more. And how do we better sort of prepare our simulation center, which is already top-notch, to deliver experiences where our nurses can be practice ready. And on day one, when they enter complex care situations, they can respond. And we want leaders. That's the hallmark of Doosan. We're not training nurses solely for their first role. We're training nurses to think creatively about how they can make meaningful contributions to our country's health. And I think that's very important for us. The Master's Entry Program in Nursing, the MEPN program, lots of excitement and enthusiasm across the strategic plan, lots of questions about this. This is something that uniformly people are saying is exciting about our school. There is no MEPIN program in North Carolina. This would be a new pathway, and it's a wonderful way to move people into our school and to develop alternative pathways into nursing, which are really exciting. Expanding simulation, more focus on our academic programs and continuing education, and then thinking about nursing roles of the future and not just doing more of the same, but how are we preparing our nursing workforce for roles of the future? I won't say more about MEPIN. I think what's exciting about it is one of the initiatives that I know the school right now is working through. And I am sort of really happy to say that the chancellor has given the school some initial startup funds to support the financial work for the MEPIN. Really, really exciting, really exciting. So I've talked about representation of nurses in health and media. And so you can see here that the point that was made from the famous Woodhull study, that in 1997, 4% of all the stories that were related to health or all the media stories in period were focused on nurses. In 2017, which is the most recent report, 2%. We haven't made progress here. We need to be cited. We need people seeking us out as having opinions about healthcare delivery, about public health and health policy, not just about nursing. Certainly we're experts on nursing, but we actually have views that are beyond nursing. And I think it's important that we elevate our voices. If you remember what Lauren said to our school, Lauren said that if we want to change the view of what people in society think about nursing, then we've got to elevate our own voices and we've got to take an opportunity to tell our stories. And I hope that we will do that and lead the way as a country in telling our story. We want to expand our resources. This is a new area for us. We've got to start thinking about ways that we can grow, but just not in the academic enterprise. I don't think unsustainable growth in the academic programs is the way to go. We want to be strategic about growing academic programs, but we need more unaffiliated supporters to our school, whether it be development, whether it be contracts, whether it be other kinds of commercialization and licensing products. We need ways to grow our resources. And we need to be thinking in sort of innovative systems approaches where we're thinking about how do we continue to evolve and that we don't just rest on Duke. And that Duke is a phenomenal brand. We're a top school, but we got to keep on asking ourselves those tough questions. And I'm proud that people have been doing that. And they've been asking, what is the future of our school as we approach 100 years of Doosan? We're working on our marketing strategy and doing that in a comprehensive way. Michael Ralph and team is working on what we're calling the Doosan Global brand and being strategic in our global efforts. We're trying to think about signature technology or health policy efforts and also engagement of unaffiliated constituencies. We are launching in the coming weeks something called Doosan Trailblazer. Doosan Trailblazer is a microsite that really puts a lot of the thinking that we've had over the last 8 or 9 months around social determinants of health into an interactive platform. It's pretty cool. It's got a lot of information about why we should care about SDOH. It's got some principles that underlie and sort of the science of where our framework comes from. And most importantly, it has our particular framework and our secret sauce as a school. It's all depicted on the site, and it's being animated and developed for future dissemination. I think you guys know that we've got issues around diversity and inclusion in the nursing workforce. No surprise here, we need to do better at attracting groups that have historically been underrepresented, men, and then also racial and ethnic minorities. And we've been doing that in terms of attracting a world-class faculty, staff, students, and actualizing our DEIB principles across our curriculum. I'm not going to spend a lot more time because I realize that I'm kind of running out of time. But what I will say here is that we need more opportunities to support everyone in our school, and that really a focus on DEIB, and this is something that I know Dr. Carter feels strongly about, is not about certain groups. It's about all groups. It's the tree and the apple. It's both children. It's all children. It's all of us being able to access the benefits of being part of this community. Very excited that our school received our second largest sort of gift to date. And so there were 3 schools involved, but the School of Nursing received $5 million to endow scholarships for our students. This was an anonymous couple, so we cannot share the name. But what I will say is that we're very thankful. We appreciate very much the support of our school. And I think in addition to the important role that these monies have for our scholarships, it also elevates our school. it means that our school is worth investing in and what we're doing really matters. And so I want to invite folks to just keep that in mind because we need that support and it's very important to do so. So proud to officially launch our strategic plan, guys, our implementation phase. Congratulations. Special thank you to our staff, our faculty, our students, our alumni, our friends. Special thank you to Chancellor Washington, who's here with us today, who's been an ongoing supporter and a really big advocate for the School of Nursing. President Price and all the leadership at the university and across Duke Health and everyone who's in attendance today. Thank you so much. It's a perfect time for questions. There are some mics that are open in the room. We can take a little bit of time to maybe respond to any thoughts. And then also if you're online and you'd like to ask a question or make a comment, the Q&A is open and feel free to chime in. Don't be shy, guys. Any questions or comments from folks in the audience?
I'll break the ice. Wow. The presentation is really a reflection of just extraordinary level of achievement in school. I was really getting goosebumps as you were going through one meritorious recognition after another. And it really is a reflection beyond the rankings of the depth of talent, but also the leadership in the school.
Thank you.
And it takes both drawing on the opportunities that are in the moment. It is a great time during this special time of change to be in a position and be able to actually lead in the manner that the school has been doing and is now positioned to do. So my first comment is just congratulations to everyone in the room. Second, wow on the mission statement. Now Vincent will tell you, every meeting we've had since you all have been working on this, he come in with a new version. And he's losing sleep over this word and over that word. So I didn't know where this was going to land. But it was like, I wanted to say hallelujah, Vincent, when I put it up there. No exaggeration. And I think the Board of Visitors was just spot on in moving that one word, transformation, up, so that it could amplify the research, but also the education and the patient care. So again, to you all, just as you look into the future, I can't think of a framing of the North Star to guide you there. And so I would say, congratulations again. Say, Vince would tell you, another thing I hit him at the door with, what's the latest on nurse-led models of care? I have in each meeting say to him, as I would say to you, I can't think of right now a greater opportunity in healthcare and just more broadly in the world of health than to bring forward the leadership of nurses to actually drive nurse-led models of care. And so to see it the way that you have included and delineated here, the way you're prioritizing it, I would say to all of you, as I've been saying, this is what we do at Duke, this is what we do at Duke Sean. Innovate and lead and have impact. And so I would just say I'm counting on you, all in the school, to innovate, lead, and have impact in all the communities we serve. Thank you.
Thank you. Thank you. Not to put Chancellor Washington on the spot, but I just want to say publicly that over the last couple of months, last year and a couple of months, I've always felt Chancellor Washington supported. And so thank you. And I feel that the school is supported. And I think that's the important piece of what I want to convey to everyone here. We are supported by our chancellor and we're delighted that you're here today. So thank you. I want to say also to everyone in the room, we've said this a couple of times. I don't know if it's coming across, but just very sincerely in a very genuine way, I know that the past year has been challenging in terms of all the work, all the coming back from COVID. I know many of us have felt like we're juggling multiple things in our personal lives and our professional lives. And I realize that we've got, our own internal challenges regarding things that we need to sort of work towards. But boy, is this a great school, and boy, is this a great faculty and staff. And so thank you very, very much. I think you guys have done a phenomenal job at pushing Doosan towards its future. And I can't imagine a more dedicated group and a more spectacular group than each of you who's in this room today. So thank you. And all the folks that are online as well. Thank you so much for that. So with that, Luana, do we have any questions online?
We don't have questions, but we do have comments. We have Stephen Powell who said, love this presentation, super excited as an alum. Dr. Shanita Randolph put, congratulations to you and to other leaders in administration. The transformation that is needed in nursing and healthcare is starting here. Within that deserves a standing ovation.
Oh, thank you. Thank you. Thank you, Shanita, and thank you, Stephen. So guys, with that, I'm standing between you and actually a reception in the atrium. Please join all of us for a great time in the reception, and thank you for being here today. It's going to be a great year. I really appreciate it. Thank you.